regarding how to prepare for NEET PG. What is the best strategy we should apply?
Sir, the best strategy to prepare for NEET PG is to go through each and every topic. And there will be some of the important topics in medicine like the CPR, seizures, Parkinsonism, and the ECG and lungs related things, which are definitely uh, which are definitely important questions that will arrive in the NEET PG. And so, sir, I want everybody to mainly concentrate in the final year MBBS questions, which are of great weightage. And but sir, we should not leave our first prof and second prof also, because in the recent time there is an interconnecting questions from the first year to the fourth year. So I think we need to prepare as a scenario based, but not as a question and answer type, or we should not mug it. That's it.
And where to prepare? What are the best platforms or apps or websites according to you? What type of
Yes,
notes?
sir.
Anything you want to share?
Sir, I prepared from DAMS Coaching Institute, sir, which is situated in Delhi, and they have branches in all over India, sir. And it's a live platform, face-to-face classes for nearly 2 months or 3 months, sir. So they will cover up the entire topic, and then they will give us time to prepare. And in the meanwhile, they will organize tests daily and alternate days also, sir.
Okay,
So I
what is the
think it is
best way? What is the best way to make notes or prepare some main things so that it can be fruitful during an written exam?
Sir, the best possible way to prepare the notes is to write down everything when we are attending the face-to-face classes, and then afterwards we need to go through the subject for once or twice, and then definitely we will understand that okay, which points we need to focus more in the exam and which points we need to focus more. But regarding the NEET PG, we need to prepare everything, sir.
And what is the pattern of exam nowadays?
Nowadays, the pattern of exam in theory comprises of two 10 marks questions and eight 4 marks questions and 10 2 marks questions for each and every subject.
And which subject to consider more and earlier rather than others? Which are we should give more priority?
The more priority must be given to medicine, surgery, and OBG, because when we cover these three topics, then definitely we can answer anything related to that topic. If we are not prepared from the first year or second year, also there's a link in medicine and surgery, sir. So we can write anything, at least to fulfill the examiner. Okay, this student has got some knowledge about this, but not the entire. Okay, let me give him 3 marks out of 5, which will be helpful, sir. So
And
better
what
to
should
cover
be
this
the
subject.
day schedule, like revision timing and everything? What should be the best process?
Sir, the best process is first of all, we need to prepare each and everything, and we need to complete the subject once. And then after a gap of 2 to 3 days, then again we need to revise. So in the gap of 2 to 3 days, we need to question ourselves. Okay, do we have, am I answering correctly or not? So I need during our brushing, we need to recall some of the moments, and during our driving on bike also we need to recall some. While sleeping also we need to recall some. Yeah, in sometimes we can't remember the answer. At that time we need to go and look in the book, and then we need to learn and again sleep, so that it will be a good memory.
Really nice way. And the practical aspect you have explained.
Yes, sir.
Yes, yes,
Because I have gone through this, sir. That's why.
yes, yes. And you have given us about like how to make notes and everything. Like suppose
Yes, sir.
somebody who is not good in one subject but good in another subject. So
Yes,
what
sir.
he should do to be good in that?
Sir, there will be a guidebook for each and every subject, sir, and we need to review the previous 10 years questions. If a student is weak in one subject, okay, not to prepare everything from that subject, but let him prepare the recent 10-year questions from that subject
But
so
previous
that
pattern as compared to current has a little
uh,
change. So is it
yes,
useful to
sir.
go with previous 10 year, 15 year? Do you think?
Yes, sir, definitely, sir. Because most of the MBBS students definitely prefer 10 to 15 years questions, and in those 10 to 15-year questions, the concept will be same, sir, but the questions which are asked will be different. So we can answer each and everything, sir. And there will be one or two questions from the last 20 years, 30 years that we can't answer confidently, but we can write at least from 2 or 3 lines. That's it.
Wonderful, wonderful. And you have given a very good way to prepare well. And is there
Yes,
any
sir.
difference between Hindi medium and English medium student? Is there any benefit to any particular medium or not?
I think English medium is best, sir, because Hindi medium, uh, the language,
Terms,
because it's
mostly terms, scientific
yes,
terms.
sir, terms, and in exam also, sir, while answering, it's easy to write in English compared to Hindi, I think, sir.
So you mean to say English medium student get more benefited?
Yes, sir,
And most of the institutes
definitely.
might be preparing in English itself. Or no, they are
English
preparing
itself,
in both.
and in English we can avail A to Z books, sir, but in Hindi there are only limited books.
Any place where we get free material, any place, or you got, or anything you gathered, something like that.
The free material I gathered from my seniors only, sir. Before some 2 years back, there used to be material in Telegram group, sir. But due to increasing MBBS seats in our country, the competition has increased and the coaching platforms also restricted and banned each and every free material, sir. And again, we should not rely mainly on the free material, sir, because there will be at least 10% new technologies, new medications in every year, and they'll be updating, sir. For example, if we get any free material from the last 2 years, we'll be stuck to that last 2 years only. We don't know what are the recent advances in the 2 years, sir. So again, it will be a minus point, sir. So better to prepare the recent thing.
Any channel which is giving free services or somewhat teaching students, which might be beneficial. Any channel, any Telegram channel, any YouTube channel.
Um,
No.
No, sir, because they won't explain details, sir. Just they will explain the important points, and after availing subscription only, he will tell the entire thing, sir.
Definitely,
And
yeah.
I think in YouTube there's a channel called Nazib Lecture, sir. But the sir who has been explaining the topics, those are more than required, sir. So again, it's a problem. Yes, sir. So I think we need only limited information which is useful for exams.
Of course, yeah. They have to take care of their livelihood.
Yes, sir. Yes, sir.
It's a part of their business and work.
Yes, sir.
But you have given very good idea to prepare and the pattern. That's wonderful.